I'm just going to show you the power of volume rendered imaging in a CT scan of the chest and how easily one can understand concepts if you actually utilize this. And I would advise radiologists to do it personally and try different settings to see how you can extract maximum information using a volume rendered image. Okay, now look at this case. Okay, so you can see this is the left lung and this is the right lung. Okay, and I'm able to rotate it. So these are the anterior margins and these are the posterior margins. So you can see P for posterior, A for anterior. All right, now if you see, you can see in the periphery and the posterior margins of the lung there's a lot of areas of loss of aeration. Okay, if you see posteriorly and basally in the right lung, posterior basal segments, again there's a lot of loss of aeration of the lung. It's not aerated. Aerated areas are looking translucent while the afflicted areas are appearing bright or dense. Okay, so what we're seeing here is fairly good amount of lung volume is preserved, but predominantly in the posterior basal segments and creeping up along the posterior margins of the lower lobes and ascending into the posterior margins of the upper lobes. There is a lot of small areas of lack of aeration. Okay, now keep this in mind, and now we're going to have a look at the CT scan. So you can see that all the corresponding areas of lack of aeration appear as interlobular septal thickening, ground glassing in the periphery, subpleural margins. Uh, this is the typical apicobasal gradient that is seen in uh, the usual interstitial pneumonia pattern of interstitial lung disease. Okay, so try to use volume studies to understand more of lung pathology.